So with this question, I also would like to add one more question to this question, doctor. So you explained how can not having sex also cause fertility. Now the other question to you is can having too much sex also cause infertility?
It's not that way. So most of the time, people think that if they have sex twice or thrice a day, the fertility chances are better, because they compare with their friend who has a child and they ask them and they say we have twice a day, thrice a day. So they want to have once in the night, once in the early morning, and like that. It's really around the time of ovulation that should help them from conceiving. Like having too much of sexual activity is not going to harm them in any way. It's left to the discreets of the couple.
Okay, got it. So also now, doctor, one more question to you is, can having multiple partners, whether for a female or for male, can that also cause infertility issues? And also with this, after the infertility issues question, my other question to you is that how can it hamper, having multiple partners? How can it hamper a male or female's body, if it can?
Okay. See, when you say the act of having multiple sexual partners itself, it's a source of having a sexually transmissible infection. So we don't know how many partners in them are already having multiple partners.
Okay.
So it's not only this particular, you take a female, she has say 4 or 5 sexual partners. In that one sexual partner can also have another 4 or 5 sexual partners. So it's a very source to have transmissible sexual diseases. So they need to be very cautious of not spreading the sexual diseases across to the other person. And this sexual diseases per se is a reason for fertility. Like when you have all the bacterial and the viral infections going on, that itself is a reason for infertility. So it is very essential to have a very safe sex, not to transmit disease to your partner, nor get infected from someone else.
Okay, got it. So also, doctor, I would like to now speak to you about vaginal discharges. So are there different types of vaginal discharges, and of which a vaginal discharge should women be worried about?
Okay. See, it's very normal to have vaginal discharges. Okay. So having a leukorrhea or a white discharge is normal. But around the time of ovulation, around the time of menstruation, we call it physiological. It's normal. But if a female finds that she is symptomatic, like the discharge is foul smelling or creating any symptoms of itching, or she has lower abdominal pain, it means she needs to seek medical attention for it. So that cannot be taken as normal.
Okay. So also, will these products available in the market? I mean, are those vaginal washes for, does they help?
Yeah.
They help?
Yeah, I wanted to tell you the vaginal washes, douches, these are all not being promoted by doctors. See, it plays with the vaginal pH. Okay. So we doctors really do not recommend it, but it is like most of the pharmaceutical companies, they have bought all these things. So when a particular woman is having a white discharge, we need to look at what is the organism grown and treat it accordingly. And a routine vaginal douching is not going to help them in any ways.
Okay. But doctor, a lot of people don't know, especially women, they don't know about it, and especially the office going ones and the young ones. So rather than those vaginal washes, what would you like to recommend for women to to clean their private parts?
See, actually, gentle soap and water should be more than enough. Douches should not be used unless or otherwise recommended by doctors.
Okay.
So whenever it is symptomatic, I think in India, it's not very difficult to get a medical advice. If people are staying abroad, I understand it's going to be very difficult for them to get a medical advice. But in India, it's not going to be of difficulty.
Doctor, also, if a couple is trying to conceive, so is there a way to get pregnant faster?
It's only like you don't postpone your pregnancy. So, and then have adequate knowledge of how to have the sexual life, or take medical assistance to know when she's releasing the egg and have a planned sexual intercourse around that time.
Okay.
An early marriage helps them, and a
Mhm.
premarital screening, like trying to screen them before marriage, definitely helps them to have better chances of pregnancy.